Competitor number 5 is Eduardo Freitas, a PhD student in health and exercise science, presenting multiple sclerosis' newest enemy.
Okay. Steve was at his son's soccer game when he started feeling this weird tingling in his left arm. He did not think too much about it until one day when he woke up and started feeling the same thing in his legs too. He went to the doctor later that week, and his doctor told him something that he will never forget. You have multiple sclerosis. He was just 32 at that time and in the prime of his life. But it happens that Steve was one of 400,000 people in the US and over 2.1 million people around the world affected by this disease. These huge numbers are estimated to cause annual healthcare costs that range from $3.1 to $21.7 billion per year, and just in the United States. So multiple sclerosis is an autoimmune disease of the central nervous system that causes muscle atrophy, fatigue, and weakness. And as it progresses, many of those who are affected by the disease will end up in a wheelchair with a very poor quality of life. While it's not possible to cure multiple sclerosis at this time, I plan on implementing an exercise and training program that was first developed in Japan and called KETSU to help improve the quality of life of people like Steve. The main goal of the KETSU training program is to increase both muscle size and strength. This will help in maintaining muscle tone in newly diagnosed patients, but it will also ensure that those who have had progressive multiple sclerosis will benefit from it as well. This relatively new model of exercise has been extensively studied and proven to work in healthy participants, but it's yet to be tested in multiple sclerosis patients. So my research is to use KETSU to induce the same positive results as traditional high-intensity exercise, with one difference. It can be performed at low intensities. This is unique and makes this model of exercise totally applicable for this specific population that has many physical limitations, and for this reason, is not capable of training at high intensities like healthy people can. You may all be wondering how this training works. Well, this is simply done by reducing blood flow to the working limbs during the exercise, like lifting weights. This allows us to reduce exercise intensity while maintaining the positive physiological responses. So, using very sophisticated laboratory devices and techniques, I'll be able to assess several physiological variables that are thought to be involved with increasing muscle size and strength. These variables include measures of muscle swelling, muscle activation, and myostatin, a specific gene that has been thought to be involved with muscle atrophy. Therefore, my goal is to let people like Steve have moments like the ones we see in this photo, not just more enjoyable, but also allow them to happen multiple times across the course of a lifetime. Thank you.